Yeah, well, there's a lot of it about, Pat. There's no doubt about that. It's out there in the community. Looking at even though much fewer people get tested now, because since February the 28th, the indications for testing were narrowed down to specific at-risk cohorts. But there's a lot of it about, and we all know that at the moment. The single most important advice, I will repeat this again, and people should know this, is if they're symptomatic, isolate, because that's when you're maximally infectious to other people. This is the single most important message for people. Even more important than the vaccines.
Yeah, because I've heard of people, they're not testing routinely now. They become symptomatic. They think it's hay fever. Mm-hmm. So they carry on. And then a couple of days later, they're testing because the suspicion it could be COVID. And 2 or 3 days after their first symptoms, they show positive on an antigen test. Because, as I say, it takes time for the antigens to be generated by the body. So what is the advice? If you've got coughs and sneezes, spread diseases, put on your mask.
Well, first, you brought up the issue of hay fever. I think most people with hay fever understand and appreciate the symptoms of hay fever, and they understand how it's different from being sick. Sure. Hay fever isn't a sickness, it's a form of allergy. So, but I would persist. I'll come to a mask in a second. It really is critically important. If you're sick and you're coughing or sneezing, that's the time you're maximally infectious. And let's not forget, why is this 0.4 and 0.5? They've displaced the other previous variants. They now comprise about 90% of cases. Why is that? They're more transmissible, probably more transmissible, and that means they're much easier to get than even the previous variants. So if you're sick with 0.4, 0.5 and you're coughing and sneezing, you are spreading that virus, and I would ask anybody in those conditions, self-isolate until your symptoms are free.
Now, it's also possible that you've hay fever, but you've also got COVID. So which sneeze is which?
Well, people make their own judgment. As a sufferer of hay fever myself, I know the difference. I think most people know the difference in hay fever and being sick. Now,
and also people who routinely get it tend to take things like Telfast and so on to keep the hay fever symptoms at bay. Yes. But they won't keep COVID symptoms at bay. That medication, one presumes.
Not at all. Not at all. And with regard to masks, just a couple of things. First of all, masks are still mandatory in healthcare settings, and it's still advised that people wear them where they feel either for their own protection or protecting other people in congested indoor settings, or whether you're living or sharing a small space with somebody who may be immunosuppressed. I know Dr. David Nabarro, the WHO advisor in COVID-19, against reintroduction of mandatory mask wearing. It's not just a question of as a matter of public policy, but also we're dealing with a variant that's much more transmissible than the previous variant. And the potential...
What you're trying to do is get people to think about what they're doing, where they're going, who they're with.
Yes.
And, they don't want to get it, but they don't, if they have it, they don't want to give it to somebody else.
Well, the kind of measure, if you felt you wanted to obliterate or to significantly reduce all possible modes of transmission, when we're back in an open society again and engaging with each other and shopping and going to pubs and restaurants and so on, the kind of mask wearing that would be required to have an impact for a very transmissible virus would be just beyond imagination.
Okay, but if you're sitting in a bus, for example, that's crowded,
that's a risk space, and that's something you might want to consider doing. And I think most people, I see an increase of mask wearing on my travels in buses in recent days and on trains, more people wearing them because people are beginning to realise there are people,
and they're thinking about their holidays. They don't want their holidays destroyed, or the wedding they're going to, or whatever,
or be stuck away on holidays.
Yeah, indeed. It won't be able to get on the plane.